Unfortunately, the issue of abuse and seclusion and restraint of children is not new to this committee. Last year, we held hearings to examine allegations of abuse and death of teens in residential treatment programs, which led us to pass H.R. 911 earlier this year. This bill establishes basic health and safety standards in those programs and was passed with overwhelming bipartisan support. That's because when we're talking about keeping our children safe, it is not a partisan issue. It's a moral obligation. Sadly, we're here again to talk about the seclusion and restraint, but this time we're looking at children in our nation's public and private schools. In January, I asked the Government Accountability Office to investigate whether allegations of deadly and abusive seclusion and restraint in our schools are founded and widespread. Simply put, the answer is yes. What they found is alarming, eye-opening, and it's going to send shockwaves to every corner of this country, as it should. The GAO will tell us very shortly that hundreds of students in this country have been victims of abuse in school. In some cases, this abuse has been fatal. It is still not limited to, though it is not limited to students with disabilities, it's happening more often to these vulnerable children. We will hear today from two parents, Ann Gatos and Tony Price, whose lives have been devastated by teachers and classroom aides who went too far. I thank them for traveling here today and for having the courage to speak publicly about the trauma that they have experienced. Federal law restricts the use of seclusion restraints to emergency circumstances for children in hospitals, in community-based residential treatment facilities, and other facilities supported by federal dollars. Yet these rules do not apply to public or private school. This means an untrained medical professional is forbidden from inappropriately restrain a patient, and if they do, there are laws specifically targeted to address such behavior. But untrained classroom staff are abusing students in schools without any accountability because of a lack of federal oversight. Our children are bearing physical and emotional burden of a system designed to fail them. Such regulation and oversight varies greatly. Many states have no laws specifically governing the appropriate use of seclusion and restraint in schools, and parents often are unaware of the use of these abuses until their child comes home with bruises or tragically can't come home at all. School is a place for students to learn, grow, and thrive, and families and communities trust teachers and school administrators to keep children safe. Yet some educators are misusing behavioral interventions that were intended only to be used in emergencies as a last resort for discipline or convenience in non-emergency situations. Last year alone, in my home state of California, California districts reported more than 14,300 cases of seclusion, restraint, and other emergency interventions. We don't know how many of these cases were in real emergencies. Recent news reports document appalling stories of teachers tying children to the chairs, taping their mouths shut, using handcuffs, denying them food, fracturing bones, locking them in small dark spaces, and sitting on them until they turn blue. One might start to wonder what could possibly cause a teacher in a classroom aide to abuse a child in this way. Well, we know that what these children did. They fidgeted in their chairs, they were unwilling to follow directions. In some cases, they left the room or avoided a difficult task. These behaviors are often manifestations of a child's disability, yet the teachers, who are often not appropriately trained to physically intervene, are restraining children anyway. The vast majority of teachers and staff working in schools are caring professionals who on a daily basis are making a difference in the lives of the children they teach. But teachers and staff who are abusing children must be held accountable for their actions. At a minimum, we should ensure that our teachers are supported appropriately through training and classroom management resources. I know educators are struggling with managing student behavior on many levels, and school violence is a difficult issue that must be addressed. Teachers and staff need to feel safe themselves, which is exactly why we must support ways to reduce the problem behaviors in schools. Approaches such as school-wide positive behavior support can help establish a social culture and a positive environment that uses data-driven decision-making to foster appropriate behavior and improve academic achievement. Such practices have been shown to reduce office discipline referrals and problematic behavior. Children should not be abused in our classrooms under the guise of discipline or punishment. This must stop now. Families should never be left wondering whether their child is safe in the care of their school, and teachers should not feel compelled to use emergency interventions to manage behavior on a regular basis. Congress must step in and fill the void that has resulted in scars that that may never heal for those children and their families who have been the victims of this abuse. I feel that the next step will be to enact a federal policy that ensures that tragic stories we will hear today will not occur again. I want to thank you very much to all of the witnesses for agreeing to appear today. And now